If you are taking a beta blocker or a calcium channel blocker, the pill in your hand is doing far more than lowering a number on a blood pressure machine. It is changing how hard your heart squeezes, how fast it beats, how wide your blood vessels stay, how much oxygen your body demands, and in some cases, how clearly your body warns you that something is wrong. And that is exactly why so many seniors tell me the same thing. Doctor, I thought I was just getting older. No, sometimes you are not feeling age. What makes this dangerous is that the side effects do not always arrive wearing a name tag. They show up as fatigue that feels like a bad week, dizziness that feels like standing too fast, swollen ankles that look like too much salt, constipation that seems like a normal part of aging, or shortness of breath that gets blamed on being out of shape. I have seen people ignore the warning signs for months because nobody ever explained what these drugs actually do inside the body. And I have also seen the opposite. People panic over symptoms that were fixable once they understood the medication, the timing, and the exact signal their body was sending. Before we begin, please subscribe for trustworthy health guidance that helps seniors protect their hearts, avoid mistakes, and stay safer. And let me say one thing clearly right now, because this matters more than anything else in this video. Beta blockers and calcium channel blockers can be life-saving medicines. They lower blood pressure, reduce strain on the heart, control rhythm problems, and help many people live longer and live better. So this is not a video telling you to fear your prescription. This is a video about understanding it. Because the safest patients are not the ones who know the drug name. They are the ones who know what the drug is doing, what side effects are common, what symptoms are serious, and what should never be ignored. Let's start with beta blockers because they are some of the most misunderstood heart medicines seniors take. A beta blocker works by dimming the body's response to stress hormones, especially adrenaline. That means your heart does not race as easily, it does not squeeze as aggressively, and your blood pressure can come down because the entire system is less revved up. That is useful if you have high blood pressure, angina, a fast rhythm, heart failure, or a history of a heart attack. But it also means something else. It means the body you are used to living in, the one that normally speeds up when you climb stairs, feel nervous, or stand quickly, may start responding more slowly and more quietly. Calcium channel blockers work differently, and this is where many people get confused because two medicines can treat the same problem while changing the body in completely different ways. These drugs block calcium from moving into certain heart and blood vessel cells. And calcium is part of what helps those muscles tighten and contract. So when you block that flow, blood vessels relax, pressure inside them falls, and sometimes the heart rate slows as well. But here's the part most seniors are never told. One subgroup, medicines like amlodipine and nifedipine, mainly opens blood vessels. Another subgroup, medicines like diltiazem and verapamil, can also slow the heart and affect how strongly it pumps. Same family name, very different body experience. That difference matters because side effects are not random. They are clues. They usually come directly from the exact job the drug is doing inside you. If a beta blocker is turning down your body's adrenaline response, you may feel slower, colder, or less able to surge when you need to. If a calcium channel blocker is widening blood vessels, you may get swelling, flushing, or headaches because blood is redistributing in ways you can feel. And if the drug is slowing the electrical system of the heart, you may feel weak, foggy, or lightheaded because your pulse is dipping lower than your body likes. Once you understand that, side effects stop feeling mysterious. They start making physiological sense. Let me tell you about Eleanor, because her story is one I see over and over again. Eleanor was 72, newly started on a beta blocker after a fast heart rhythm sent her to the emergency room. 2 weeks later, she told her daughter she felt flat. Not exactly sad, not exactly sick, just drained. She could still do her chores, but every task felt heavier. Folding laundry felt longer. Walking to the mailbox felt like work. She thought maybe she had finally hit that stage of aging everyone warns you about. But the truth was much simpler. Her heart was no longer reacting to activity the same way. The medicine was protecting her, yes, but it was also reducing the surge she used to feel with movement. That is one of the most common beta blocker side effects: fatigue, reduced exercise tolerance, and that strange sensation that your engine is running on low. And the reason is not imaginary. Your heart rate does not climb as easily. Your body's go signal is softened, and muscles may feel as if they are waiting for energy that never fully arrives. For some people, this improves after the first days or weeks. For others, it lingers because the dose is too strong, the pulse is too low, or the medication choice is not the best fit. What worries me is how many seniors never mention it. They assume they are lazy, frail, or losing stamina. Sometimes they are not losing themselves at all. They are feeling the medicine's intended braking effect. Now, fatigue by itself is uncomfortable, but fatigue plus dizziness is where people get hurt. I remember a gentleman named Walter, 78, who had recently started a beta blocker and kept telling his wife that he felt wobbly when he stood up from his recliner. He did not faint, he did not collapse. He just had that brief shifting sensation, like the floor moved for 1 second before he caught up to it. One morning, he stood too fast to answer the phone, turned, and nearly went down into the coffee table. That near fall scared him. The pill had lowered his blood pressure and slowed his heart enough that his body was adjusting more slowly to position changes. And in older adults, those few seconds can be everything. This is why dizziness, lightheadedness, and falls are not minor side effects in seniors. They are major life events waiting to happen. When blood pressure is lowered or the heart rate is slowed, especially in someone who is already dehydrated, already taking several medications, or already unsteady, the margin for safety shrinks fast. You may notice it most when standing up, after a hot shower, after using the bathroom, or when getting out of bed at night. And here's the tricky part. You may not even feel sick. You may just feel off, slightly washed out, slightly unsteady. In a younger person, that may mean inconvenience. In a senior, it can mean a broken hip, an ER visit, or the beginning of a fear of walking that steals independence. Another beta blocker effect that surprises people is cold hands and cold feet. Patients laugh when I mention it until they realize that is exactly what has been happening to them. They say, "Doctor, my fingers are freezing all the time now," or "My toes feel cold even under blankets." That happens because these medicines can change circulation in the small blood vessels and reduce the body's tendency to push blood aggressively into the extremities. So the heart is safer, yes, but your fingertips may feel like they are living in another season. It is not usually dangerous by itself, but it can be miserable, especially in older adults who already have circulation issues or conditions like Raynaud-type symptoms. Then there are the side effects people almost never connect to the medication: sleep problems, vivid dreams, and a restless night that seems to come out of nowhere. I have had seniors tell me, "Ever since I started this heart pill, my nights feel strange." They are not always describing classic insomnia. Sometimes they mean more intense dreaming, more awakenings, or a feeling that sleep is lighter and less restorative. Not every beta blocker causes this in every person, but it happens enough that it deserves attention. When your body's stress signaling is altered, your internal rhythm can feel altered too. And for a senior already struggling with sleep, even a modest change can affect mood, balance, memory, and energy the next day. Some people also report feeling emotionally blunted, foggy, or less mentally sharp after starting a beta blocker. Now, I want to be careful here because many things can cause low mood or brain fog in later life, and I never want you to assume your medication is the only cause. But when a patient tells me, "I just don't feel like myself since I started it," I listen. Less common side effects can include depression-like symptoms, trouble sleeping, and that vague sense of being dulled. Not everyone gets this, and some studies debate how strong the link is in every situation. But clinically, patients do bring these complaints forward. If the timing fits, if the symptom appeared after the prescription changed, it deserves a real conversation, not dismissal. And yes, we have to talk about sexual side effects because seniors are too often treated as if intimacy no longer matters to them. It matters. Quality of life matters. Confidence matters. Relationships matter. Some people taking beta blockers notice difficulty with erection, reduced arousal, or a general feeling that the body is less responsive than before. This can be from changes in circulation, changes in the nervous system response, or simply from feeling more fatigued and less energized overall. What breaks my heart is how many patients stay silent out of embarrassment. They would rather protect the doctor from an awkward conversation than protect their own marriage or self-esteem. If this started after the medication, it is not vanity to mention it. It is part of the treatment picture. Weight gain can also sneak into the story, and it is not always because the medicine directly adds pounds. Sometimes the process is more indirect and much more frustrating. You feel more tired, you move less, you exercise less intensely because your heart rate does not rise the way you expect. Your daily burn drops. A short walk becomes your full capacity instead of your warm-up. Over time, the scale inches upward, and you blame yourself. Some beta blockers are associated with modest weight gain, especially early on, and even a few extra pounds can worsen blood pressure, knee pain, sleep apnea, and blood sugar control. So the side effect is not always just weight. It is the chain reaction that begins when energy and movement quietly decline. Now let me show you one of the most dangerous hidden effects of beta blockers, especially if you have diabetes. These medicines can mask some of the warning signs of low blood sugar. Normally, when blood sugar drops, many people feel a pounding heart, shakiness, and that internal sense of alarm that says, "Eat something right now." But a beta blocker can blunt some of that response. The heart may not race the same way. The tremor may feel muted. The usual panic signal can be quieter. And that means the first clue of a low sugar episode might not be early discomfort. It might be confusion, sweating, weakness, or feeling suddenly strange when the situation is already more advanced than you realize. I once spoke with a retired accountant named Jerome, 69, who had type 2 diabetes and had recently been started on a beta blocker. One afternoon, he was in the grocery store and suddenly felt odd, almost detached, like the lights were too bright and the aisle was moving around him. He did not feel his usual warning signs. No dramatic pounding heart, no obvious tremor, just confusion, sweating, and weakness. His blood sugar was low, but the medication had taken away the familiar alarm bells he depended on. That is what makes this side effect so serious. It is not merely that low blood sugar happens. It is that the body's early warning siren may be softer. And in a senior